Hello, we are here with Dr. Anna Maria Hoffmann-Vold. It's my biggest pleasure to ask you the question on the impact of mild ILD in systemic sclerosis patients. Does it have these patients have a better prognosis, worse prognosis? Could you comment on that?
Thank you very much. And that is actually a very interesting and important question. So we address this because we do know that interstitial lung disease is the main cause of death in our patients. So we wanted to see whether milder ILD also, or patients with milder ILD also die of respiratory causes. So we looked in patients in the Oslo University SSC-ILD cohort. We found that about half of the patients who died with SSC-ILD died of respiratory causes. And when we looked in these patients again, actually very interestingly, half of the patients had mild ILD. And this is like with a lower extent of fibrosis on HRCT, preserved lung function, and no respiratory symptoms. And when we looked at what they died of, this was the majority of respiratory infections and still a quarter of the patients of respiratory failure. So this really means for us in clinical practice, we need to take care also of our patients with mild ILD, consider treatment to prevent worsening, and also we need to take into account the respiratory infections that they may cause death in our patients.
Thank you very much. It was really interesting. Thank you.
Thank you very much.